subscribe now and press the bell icon. Never miss an update.
Hello and welcome to Health Live at Seniors today. We have here with us Dr. Kirti Sabnis, who's an infectious disease specialist at the Fortis Hospital. Over the last 2 or 3 weeks, we've been hearing stories and cases of COVID rising once again, especially in Delhi and the region. And we also read about the fact that masking has become compulsory in Delhi and NCR. And we thought it would be good to have Dr. Sabnis, who is attached to the Fortis Hospital and who has been with us in the past, to talk about the COVID XC variant, the prevention and cure for senior citizens, of course, for everybody else also. Dr. Sabnis, as we know, is attached to the Fortis Hospital in Mumbai and has completed her MBBS from the DY Medical College in Kolhapur and is a postgraduate from the National Board in Infectious Diseases from the Bangalore Baptist College. She has also done a 2-year post-doctoral clinical fellowship in infectious diseases from the CMC Vellore, with nearly a decade's experience in infectious diseases and specialized training on HIV treatment, venereal diseases, immunization, infectious diseases, and tuberculosis. Dr. Sabnis plays a crucial role in the battle against COVID-19. Not just patient care, but she has also extended her efforts to community care and leading multiple digital initiatives that were aimed at community education empowerment. Welcome to Health Live at Seniors today, Dr. Sabnis. Delighted to have you here with us once again. How have you been? How's the COVID situation for you at Fortis Hospital? Because Fortis is there across the country in Bombay and in Mumbai and Delhi.
Yes.
What is the feedback that you're getting?
So what is happening is, as we have discussed already, so COVID is basically a respiratory virus. So we are bound to get few changes, increasing in the number of cases as the season changes. So, and the virus by itself is a highly shape-changing virus. In a scientific language, what we say is mutagenic. So there will be a lot of changes in you must be hearing few technical terms like BA1, BA2.1, then Delta, and then in between Omicron. So these are the different strains. And the new variant which we are going to discuss today is COVID XC. So these, because of these variants, we are having slightly increase in number of cases. But as of now, even in our Delhi hospitals, there is no increase in the rate of admission. Even in Mumbai hospitals, there is no increase in the rate of admissions. As of in Mumbai, our Mulund ward, which was a dedicated COVID, almost in a peak season, we had almost 100 patients at given time. Right now, we don't have any suspected or even proven cases. So overall admissions are getting less, as we were discussing. And patients are increasing. That will happen because of the new variant will come, but overall the cases are remaining to be managed at a home quarantine basis. And generally the patients who are getting these infections are having some or the other immunity issues, like patients are on a chemotherapy, or patients are having some kind of immunity low, like transplant patients. Those patients are having more symptoms and requiring medical assistance.
But doctor, all of this starts in the same way, right? When even the earlier version, the 3 variants that we have had, the 3 phases that we have had, whether it's the first one, the second one, which was Delta, the third one, which is Omicron, it all started in a smaller way, but it suddenly kind of builds up by big numbers. So is there, and that's what causes the worry and causes the scare, because what might be very small now might grow to become very big. And we've just read, for instance, for us here in Mumbai, we just read that the 3 jumbo centers of the municipal corporation have been dismantled. And so is there, but and which is the reason why we've invited you today at fairly last minute, because we were receiving a lot of questions, is that what is the fear and how do you ensure from what you tell me, you just mentioned, and you mentioned in the past as well, that this is a virus which mutates and which will keep mutating. So
Yes.
the entire strategy now is that we need to be doing various things to ensure that we don't get we don't contract the virus. So let's hear from you as to what do you think should be the strategy, if I would say, to ensure that you don't nobody gets contracts the virus.
So strategy wise, if you say, not see what we have seen in this new variant, the XC, it is slightly more transmissible than before viruses which we have come across, like Delta. There is not great head-to-head comparison available between Omicron and XC, but yes, slightly more transmissible than the previously available viruses. So we need to be definitely making sure that people who are the vulnerable people, who is the vulnerable group amongst this, is people age very young crowd, less than 5, people who are having some kind of an immunity issue, people who are having uncontrolled diabetes, people who are on chemotherapy. So these, we have to make a strategy for this immunocompromised group or vulnerable group. Young people without any comorbidities, even if they get infection, mostly will be mild. So what as a strategy, first we have to ensure that everybody has taken their age appropriate doses for the vaccine. That is very important. We have 3 vaccines available. All 3 are efficacious. So as a strategy point 1, everybody has to be vaccinated, what is recommended for their age. And if you have immunocompromising issues, it's better that you take the booster. So that is number 1. Second, it's
sorry, Dr. One second. You said that if you have any issues, only then should one take the booster, or is the booster required for everyone?
The booster is required currently for the people who are having issues with the immunity, people who are post-transplant, people who are more than age 60, because those are the people who are vulnerable for having complications. So we should have strategies for them. Actually, because it's a new, overall the boosters concept of the vaccination is new. And how is the immune response calculated? That also is under the overall research. Like suppose I say the booster of the COVID vaccine works for 1 year. Like we know for pneumonia, for flu, the booster works, for flu vaccine, the booster works for 1 year. Every 1 year, the new strain comes, and the people who are eligible to take the flu vaccine take flu vaccine every year. So like that strategy for COVID, we are yet to devise. So over the next coming years, mostly a year or 2, we will be overall as a research from a scientific community, we will be able to devise a strategy like, okay, this is the duration for booster. Let it be 6 months, let it be 3 months, let it be a year. So that strategy is mainly we have not devised for a normal immunity people yet. So people who are having immunocompromising issues, they better complete their 3rd dose of booster until the wave is increasing, which might be happening over this coming monsoon season, because that's our routine season for the flu as a respiratory virus. Like we say cough and cold and season, it's our mainly which is monsoon, pre-monsoon. So that we are likely to have more cases in coming next a month or 2. So it's better people who have weak immunity, people who are more than 60, complete their booster now. So because the immunity takes at least 15 to 20 days to form. Today you have taken vaccine, tomorrow you will not be protected. So we need to give at least 15 days for your body to form an immunity. So that's why that is the strategy number 1, that everybody should complete their boosters in this coming month, whatever pending boosters are.
But the response, for instance, the booster doses they were allowed for people above 60 some months back, and now from the 10th it has been allowed for everybody above 18. But the response to the booster dose has not been very good, and people are a little wary of. People are unsure, because they're saying that it's all trial and error. The medical fraternity, the pharma fraternity, all of them are doing, it's a trial and error, and they're not very sure about whether it is really effective or not. And I'm saying this because, this is what a whole lot of people are saying, despite the fact that we've had you in the past, we've had Dr. Rahul Pandit in the past, we've had, various other doctors in the past who have all been underscoring the need for a vaccination. But despite that, there is a feeling that, well, vaccines are there, but the government doesn't know itself as to what it should be doing. The doctors are saying this, etc., etc. So, can you, I'm sure you are facing a lot of queries like these from people who are naysayers. And even if they're not naysayers, they are questioning. They are now beginning to question whether there is a real, the right answer for solving the problem. Because sometime back, as you know, that there was this case in the courts which was about masking, and the government was not able to even provide a proper answer to why masking is important, and that why were they fining people for masking. So what I'm trying to ask you is that, is it a lot of trial and error that is happening, or is there or are you just saying that this is good to do to be on the safe side? If you want to try and take risks, you can do it, but this is what we would advise you should do. I'm sorry to put you into a spot, but
no, that's always been once you are an infectious disease consultant, because that's always been since last 2 years in various places we are in the spot. So what is scientific information? So the best way to deal this is who needs to take vaccine. Definitely, as I said, the boosters are going to be a part of COVID. We are not yet able to finalize because it's a short span of 2 years. Majority of the times when the vaccines are tried and the boosters are decided, it's at least 5 to 6 years, 10 years period. We know how the immunity is faring, what are the various age groups who are having the illness, and what is overall complications if the people don't take the vaccine. So that data is limited with current changing variants of COVID. But we definitely know from various parts of the world, be it UK, US, Canada, even Africa, from where the last variant emerged, or India, that the vulnerable people above 60 and people whose immunity are weak are definitely the people who take long time to recover once they get it, and are having a high chance of going on a long COVID or a post-COVID complications. So these people definitely should take the vaccine without having any second thoughts in their mind. As we say, 2 doses, and the third booster from 9 months of the last dose. So that's the correct, I will put it. Young people, if they don't have any side effects with the previous vaccination, few people have had side effects other than routine. All vaccines cause pain. All vaccines can cause a day or two fever. Few people, very few to name, have had issues with the platelets, have had issues with the sometimes low platelet count, or having rash. So except these major side effects, for which definitely you would have, those would have consulted a doctor, and they would have mentioned, okay, this type of COVID vaccine, you don't take it again. Unless these things, even we are vaccinating now pregnant females. So I feel until we devise the strategy, the vaccines are relatively safe. We should make use of the boosters. Definitely, yes, for the people who are above 60 and having comorbidities, even less than 60. I'll put it like that. Definitely, it is a must for them. Other people, it is good to take, definitely. If your health is good, anyway, still don't want to take a chance to have a severe COVID with the changing variants. How it is overall the immune response. The COVID is nothing but it's a viral illness, but the virus doesn't stay in your body for beyond 10 days. So whatever the long COVID or the post-COVID complications people develop, it's the balance between your immunity and immune reaction. So with the changing variants, we will not be able to predict in each person. Overall, I'm saying if I have 100 patients, the severity is less. But for even 1 or 2 patients of those might have a severe illness. So that severity of the illness definitely can be prevented with vaccination. So it is definitely good to take for everyone above 18, since it is going to get administered after 10.
All right. Sorry, we've discussed the vaccine quite a bit. Is it okay to take the same? I've had two shots of Covishield. Now, should I take Covishield? Because if I take it by what the government says, I should take Covishield. But I might know some friendly doctor somewhere, and I said, well, why don't you administer Covaxin? Tell me, is that a safe thing or an unsafe thing?
Now I'm at a gunpoint. I'm not a spot. Okay, let's face it.
Sorry. But tell me, I'm saying these are genuine things which are there. People are saying, chalo, let's do a cocktail. No, ek do liya hai iska, so now let's try another one. Is that something that is advisable? Because that was one line of thinking in the very early days, and we've had some doctors over here itself who had said that first you've taken a Covishield, now take a Covaxin. But now the government is not saying this. So, but and one of the reasons why there is some hesitation, and I can tell you there's some hesitation from some of my friends, is that, well, let's see, perhaps the government might change its stand on this. So let's take a cocktail as against just the same vaccine. So what is the scientific theory, and as a specialist on infectious diseases, what is the right advice for this?
See, so as I said, that the vaccination there is what is called as in simple language is mixing, and it's taking a Covishield or Covaxin before and taking a different vaccine, because the mechanism of action is slightly different between the two. Second time, it's called as mixing versus non-mixing. So both the strategies have been studied, even though in a limited population. Yes, it's been studied, and both of them have shown an equal result. Like, what is the protection? What is the chance of getting COVID after taking 3 doses of Covishield is almost equal if you've taken 2 doses of Covishield followed by Covaxin. So I will say, rather than thinking about and waiting, like as you said, a few people are waiting that the government will allow us and that will come in the record, and then we can take. So I will say, rather than waiting on the change of the strategy, we should make sure that we are taking the third dose, because both have shown equal responses for prevention of COVID.
Let me ask you, an unfair question, doctor. You must have taken the booster. Which was the third dose that you took?
I took the Covishield.
And the first 2 doses?
Covishield, same one.
So you stuck to, no, obviously, if you are doing it for yourself, and as a doctor, you know what's best for yourself as well. And that's why I asked this question. Those of you who have questions, otherwise I have a host of questions to ask Dr. Sabnis. I have a list of around 25 questions here, but those of you who have questions, please put them in the Q&A tab. If it's something which is very specific that you have for yourself, please put your age and your gender so that Dr. Sabnis can give a response to us. I'm not going to hold her by gunpoint. I'm not going to, but I'm just going to ask her for some very point. I'm going to ask her.
So these are the practical things. Obviously, everybody have faced this sometime or the other. So they're very valid questions, as Mr. mentioned.
Tell me, doctor, what is this issue about masking? Should we be masking up or should we not be masking up? I was there today. Somebody from my family had gone out somewhere at an exhibition in Kolhapur, and there was nobody wearing a mask. Whether it is a senior citizen, whether it is a non-senior citizen. I have colleagues who travel by local train, and they say that nobody is wearing a mask. So that one decision of the government that mask is not compulsory has just led people to get rid of it. So what is medically the right thing to do?
I think this is also very important. People making it compulsory was very much necessary for the government, because initially we don't know how the route of transmission was, and the load of cases which we used to get was a lot. So when we are opening up, it was definitely for a protection to reduce the number of cases, this was the government could offer us that time. But as you see the transmission, as you see the newer variants coming, are having more and more transmissibility than what we have seen before. Initially with original COVID-19, then with Delta. So we are having more infectivity. So what is, if I am removing the mask now because there is nobody with me, I'm still carrying my mask. I will say in a limited, unless you have a very good ventilation, like in a stadium, which is like with a very open areas, where there is a density of the people is very less, like 2 or 3 people in a closed room with a good in a room with a good ventilation, and whom I can trust to know the history that they are not symptomatic. Only I'll dare to remove my mask. Otherwise, still, even other people are removing my half of the my own people at my house also don't wear the mask half of the time. But still, I will believe that the masking is the only thing which will prevent from getting new infection, because we can't predict the transmissibility is high, so we can't predict that the infectivity is going to be low. So I will suggest we should stick to masking. So once I say this, which mask to be used? So as I said before also, for a non a hospital, because hospital will be more crowded and more chance of having people with infection, non-hospital use can be a double mask with a normal one, surgical, and a cloth mask. In a hospital, it is better to use an N95. It is more important that you change the mask every day rather than wearing the same mask again and again. So which kind of a mask you use, rather than how you don't touch the mask from outside once you wear, and how you change every day is more important.
Yeah, I think that's a question which has been answered by Dr. Sabnis, and she had suggested the ways and means of doing it. I'm going to request our producer to put up the link in the chat window of Dr. Sabnis's last session. So those of you who haven't watched it or who have watched it also, please look that up. But Doctor, my question to you is that, let me ask you give you a few instances. Okay, in a typical home scenario, there is somebody who comes in, your post person comes in, the courier person comes in, there's somebody who gets the clothes, or the kirana shop person who comes in. Now, should you be wearing a mask when you're opening the door? And should you insist that other person also wears the mask when she or he is coming to the door? And also, what about domestic health? Should you be wearing a mask about the domestic health? Should you be insisting that the domestic health also wears a mask, and should you be also wearing a mask like it was there in the first phase?
So these are two different things. We'll answer it first part as because some vendors coming in, the contact is going to be very brief. And as I said, if the brief contact is there, wearing mask by both people is only going to help. If you are wearing the mask and the person who is coming is not wearing the mask, will not help. So if you don't have symptoms, like asymptomatic or mild symptoms also, if you don't have, and if you don't wear mask, it's fine. But you don't know whether the person who is coming to your house, whether they have symptoms. So person who is having symptoms, wearing a mask is more important to reduce transmission rather than people who are not having any problem are wearing the mask. So I think for a brief contact, like vendors and all are coming, we should insist them, both of them wearing a mask, even if it is for the brief time. And domestic help, I think they let them wear mask plus minus, because checking them and asking them for symptoms every day is more important, because domestic helps are going to be in the house for quite long time. And overall incidence of cases are coming relatively low than what it was before. So if the domestic help is not having symptoms, if you don't insist her on wearing mask, I think that should be okay, no problem.
So tell me, suppose, what should be the general brief advice to the domestic health, that, as it was there earlier, that if the domestic health has a cold, cough, headache, whatever, just don't come home? Is that what the advice should be?
This becomes very tricky because these symptoms
No,
can be.
we will not hold you responsible for the
No,
domestic.
I'm just telling because help might say practically. We are trying to answer everything here. Very relevant questions. I must say, Mr. Maheshwari, it's very important because these are the everyday questions that we don't know where to find answers whether this is correct or not. So this is very important, I think. So asking domestic help for only cough and cold to take leave, then it will be leave like almost half of the month she might not come. So which is not practically possible. So what normally I tell is what I practice at home. So if the domestic help is having cough and cold and there is no fever or there is no diarrhea, with a good hand hygiene and wearing a mask, generally they can come because cough and cold can be any other virus. If there is a high grade fever with body ache and diarrhea and or with respiratory symptoms, I tell them to take off for at least 5 days.
At least how many days?
5 days. 5 days.
5 days.
Because that's the infectivity considering the COVID.
Doctor, we've received quite a few questions for you. I'm going to raise it one after the other. I know we are at 5:31 and you are in the hospital. I'm going to ask you the questions as soon as I can. So there's a question from Kashi Vishwanathan who says there's an alumni get-together being planned in July. What precautions should I follow if I decide to attend? He hasn't mentioned his age, but I presume he's a senior citizen.
So Mr. Kashi wants to attend alumni meet, right?
That's right.
It's very important to know the age because the precautions will change, but we'll consider senior citizen because that's the maximum
That's
precautions.
right. He is 74. He is
74. Yeah. So I will suggest first, as I said, you have to complete your boosters. That's very important. And second, I will suggest you to be, because it's going to be a closed area. Obviously, it's an alumni meet. There will be, see, there are aerosol generation, as I've seen discussed in the last discussion. We had a presentation also. There will be laughing, screaming. All this is going to generate a lot of aerosols. So I will suggest to at least to wear a double mask when you go in all these areas.
And don't hug and
hugging is that is with the mask is, we can say, unless you're washing your hands and removing the mask, you're not going to get the virus by hugging.
So good hugging and embracing is fine, can be fine, I would say. I shouldn't be saying this.
Not completely.
We have a question from Vijendra Kumar, 77, Mumbai based. He says that the booster should be taken after 9 months and from the second dose. Can you confirm? He says he suffered from COVID in February this year. So when can he take a booster?
So
and he took a second dose again.
Yeah, I got it. So how it goes is, if you have had COVID, actually what is the government is allowing is 3 months from the last COVID infection, symptomatic COVID infection, and the 9 months from the last dose, whichever happens later. So you had your COVID in February. So February, March, April. So you can take your COVID vaccine dose in May.
Doctor, this is a question which is asked, which is not exactly COVID related, but I guess it's also because of COVID that this question is being asked. This is from Shankar Chavan. He asks, is it safe to get operated for a reducible hernia at the age of 82? I guess he's asking this because of the COVID scare.
COVID situation. Yeah, overall the cases load is less. It's an elective surgery, I agree. But you take your boosters and I think go ahead because COVID is going to stay here for a while. So you can't keep on postponing your surgeries. So like my own father-in-law got operated for cataract, which is an elective surgery. We got it done because the caseload is relatively less and we have given the boosters. You can go ahead.
Thank you. How can we have a session without a question from Kirti Sabnis? She's asked a question. Doctor, we were told that they are coming out with the nasal spray. Is that not a better option than boosters when some say not to take the booster as it may not be as effective for the fourth variant if we seniors don't go out that often? So is there a nasal spray? Is it out? Is it advisable?
So the nasal vaccine, nasal spray is this a nasal vaccine? It is available. Not currently in India, but yes, it is available abroad also. And it is a live vaccine. So the efficacy is good. As a booster, it can be used. People who have certain drug allergies, should be little cautious about using the nasal spray vaccine. But it can be taken. That's not a problem. It is not like it is more effective. It is as effective. Currently, the data is it is as effective as the other vaccines to prevent COVID infections or prevent a serious COVID infection. So yes, it can be taken. That's not a problem.
And are there any after effects of the nasal spray?
No major after effects. Only people who, it's a live vaccine, so people who have certain preservative allergies are contraindicated to take it.
Doctor,
so you need to consult a physician and take it.
Doctor, I know it's an unfair question to ask you because and it's an unfair thing to ask you to reply to it. But if I'm able to get the nasal spray from a friend, cousin, whoever is coming from abroad, or there are various shops in the city, in our cities, where you do get imported goods, your fragrances and various things that you get, which are got by people. Is it safe to get a booster, to get a nasal spray from an unauthorized source, or from a friend and family who's coming down from the US or wherever?
See, it is a very important question. Many people try to jugaad this way because they feel it is best. But what I will suggest is the vaccines are not normal medicines. Vaccines require a very dedicated cold chain and mechanisms to prevent. So these unauthorized services which are giving you the vaccine, we don't know how it has been preserved, how it has been made available to you in India right now. So I will urge, because all the vaccines are working equally to prevent the major COVID illnesses. So I will suggest, rather than doing all these things, you can take a routine vaccine which is made available with us, which we know at least has been well preserved and delivered to us normally.
And it is not expired. There was a controversy about some viruses, some vaccines being expired, etc. in the last time around. So,
yeah.
So it's all safe.
If you're going abroad and taking the vaccine there, that's altogether a different story, because the cold chain is being maintained. Who is going to administer you the vaccine has checked the authenticity of that. So that is fair enough. That is no problem. You can go there and take it rather than taking unauthorized in India.
Doctor, I don't think this question is asked by a senior citizen, because otherwise you would have taken the booster. But the question is that, is it an advisable thing that by default take a tablet of paracetamol after you have taken a booster dose? When the first time he says, when I took the vaccination, I was given 4 tablets of paracetamol to have. Is it advisable for the booster or it is not?
And so first, initially, there were few centers were giving paracetamol by default to the people. Yes, I agree. But see, it is a symptomatic treatment. All vaccines work by the same way. They will cause a kind of an inflammatory response in your body. So they will have local pain. People will have low-grade fever. So it is not compulsory. It is how you can tolerate the pain. And generally, I don't advise my patients to take paracetamol for a fever less than 100 Fahrenheit. If it is going more than 100, definitely they can take 1 dose of paracetamol. No problem.
But
it's not compulsory.
Just minor body pain, lethargy, feeling, you shouldn't take any paracetamol?
It is for symptom wise. If you're able to go through routine work with that mild body pain, no need to take. It is not taking paracetamol is not going to change any effect of your vaccine. The vaccine will work the way it should, even if you take paracetamol, even if you don't take paracetamol.
Right. We have a question from Kunj Bihari Trilokikar. Says, my wife is 77 and has taken all doses, including the booster dose as prescribed. For the last 2 weeks, she has no taste, but can smell all right. There are no symptoms like running nose or fever. Is this a symptom for COVID? Any advice?
See, generally the loss of taste can be because of various causes. With the age, people generally tend to develop superficial oral fungal infections also, which can alter the taste. There are few medicines who are given for BP, who can have change in the oral taste. So unless there is constitution of all symptoms like fever, running nose, and loss of taste, eventually only loss of taste will not happen. If you are really having an infection, eventually you will have one or the symptoms after that. So loss of taste followed by loss of smell, followed by fever, running nose. So either of these constellation should be there. Only loss of taste without loss of smell and no other symptoms is not only the symptom of COVID. We should look for any other causes for loss.
Right. Thank you. The question which is which we also have is from DJ Santa Maria, DJA Santa Maria. He says, all over, even in China, improving immunity with mask is more relevant than the vaccine. Is that something that you also believe in?
You see, normally we say don't put your eggs in one basket. It holds true here also. We have to, there are different arms of immunity which we are looking at. There are different ways of protection which we are looking at, and ultimately our aim is to see people might not be able to prevent infection 100%. I don't think so there will be anybody with our discussion or hearing us has not had COVID-like symptoms in last 3 years. Everybody would have got cold, cough, might be COVID. We have not done the test. So ultimate our aim is to not, it's not like being COVID negative all the time. Our aim is to prevent COVID related complications even if you get the infection. So we need to prevent the long COVID. We need to prevent post-COVID complication in susceptible group. That is our aim. So that's why all this will work together. I don't think so. If you use only the mask and don't take your boosters, you will be equally protected.
Doctor, we have received a question, and I know what perhaps your response would be, but I'm saying this is a question from Gedhai Lutria on acupressure being a solution for infectious diseases. But the last time around also you responded to this thing, but is there any change of view on acupressure, on various such treatments, Ayurveda, homeopathy, etc.? Is there any way, does that help in immunity? Does that help in infectious diseases? Is there a view on that?
It is little difficult for me to answer it completely, as you understand, Mr. Maheshwari. See, those sciences are age-old sciences, might be working. I would not say we can use them as an additional therapies, but there is, unfortunately, we don't have a good published data on that to say that it definitely works. As I can say, okay, vaccines will at least prevent the serious complications in majority of the patients. Unfortunately, I don't have a scientific data with me because I'm not an expert about that. I will not prevent them for people who go for it, but they should not say that only these things will work and I will not take vaccine. They can, as various arms we are trying, we can try that with a good sterile way. Acupressure and acupuncture should not cause you any additional skin infection.
Thank you very much, Dr. Sabnis, for taking time at such short notice. And I'm sure, like us over here, the seniors today community here, I'm sure there are various other people who are also asking questions to you and who are waiting for answers. But thank you once again. Once again, I know I put you into a spot with a few questions, but these are questions that exist in the minds of people, and you have answered all of them so very effectively and so very clearly that there will be no doubts in the minds of people. Thank you once again, Dr. Kirti Sabnis, for taking time on a Saturday evening from your hospital, and thank you to the folks at Fortis Hospital for having facilitated this. Thank you very much once again.
Thank you. My pleasure, Mr. Vaishvi, as usual. Thanks a lot. Thank you. Take care.
We will be back once again next Saturday at 5 p.m. That is the 30th at 5 p.m. with our next session of Health Live at Seniors Today. Thank you. Bye.
Subscribe now and press the bell icon. Never miss an update.